Vitamin E. What is vitamin E and what does it do? Vitamin E is a fat-soluble nutrient found in many foods. In the body, it acts as an antioxidant, helping to protect cells from the damage caused by free radicals. Free radicals are compounds formed when our bodies convert the food we eat into energy. People are also exposed to free radicals in the environment from cigarette smoke, air pollution, and ultraviolet light from the sun. The body also needs vitamin E to boost its immune system so that it can fight off invading bacteria and viruses. It helps to widen blood vessels and keep blood from clotting within them. In addition, cells use vitamin E to interact with each other and to carry out many important functions. How much vitamin E do I need? The amount of vitamin E you need each day depends on your age. Average daily recommended amounts are listed below in milligrams mg. Life stage recommended amount: birth to 6 months 4 mg, infants 7 to 12 months 5 mg, children 1 to 3 years 6 mg, children 4 to 8 years 7 mg, children 9 to 13 years 11 mg, teens 14 to 18 years 15 mg, adults 15 mg, pregnant teens and women 15 mg, breastfeeding teens and women 19 mg. What foods provide vitamin E? Vitamin E is found naturally in foods and is added to some fortified foods. You can get recommended amounts of vitamin E by eating a variety of foods including the following. Vegetable oils like wheat germ, sunflower, and safflower oils are among the best sources of vitamin E. Corn and soybean oils also provide some vitamin E. Nuts, such as peanuts, hazelnuts, and, especially, almonds, and seeds, like sunflower seeds, are also among the best sources of vitamin E. Green vegetables, such as spinach and broccoli, provide some vitamin E. Food companies add vitamin E to some breakfast cereals, fruit juices, margarines and spreads, and other foods. To find out which ones have vitamin E, check the product labels. What happens if I don't get enough vitamin E? Vitamin E deficiency is very rare in healthy people. It is almost always linked to certain diseases in which fat is not properly digested or absorbed. Examples include Crohn's disease, cystic fibrosis, and certain rare genetic diseases such as abetalipoproteinemia and ataxia with vitamin E deficiency, AVED. Vitamin E needs some fat for the digestive system to absorb it. Vitamin E deficiency can cause nerve and muscle damage that results in loss of feeling in the arms and legs, loss of body movement control, muscle weakness, and vision problems. Another sign of deficiency is a weakened immune system. What are some effects of vitamin E on health? Scientists are studying vitamin E to understand how it affects health. Here are several examples of what this research has shown. Heart disease. Some studies link higher intakes of vitamin E from supplements to lower chances of developing coronary heart disease. But the best research finds no benefit. People in these studies are randomly assigned to take vitamin E or a placebo dummy pill with no vitamin E or active ingredients, and they don't know which they are taking. Vitamin E supplements do not seem to prevent heart disease, reduce its severity, or affect the risk of death from this disease. Scientists do not know whether high intakes of vitamin E might protect the heart in younger, healthier people who do not have a high risk of heart disease. Cancer. Most research indicates that vitamin E does not help prevent cancer and may be harmful in some cases. Large doses of vitamin E have not consistently reduced the risk of colon and breast cancer in studies, for example. A large study found that taking vitamin E supplements 180 mg per day 400 IU for several years increased the risk of developing prostate cancer in men. Two studies that followed middle-aged men and women for 7 or more years found that extra vitamin E 201–268 mg per day 300 to 400 IU, on average, did not protect them from any form of cancer. However, one study found a link between the use of vitamin E supplements for 10 years or more and a lower risk of death from bladder cancer. Vitamin E dietary supplements and other antioxidants might interact with chemotherapy and radiation therapy. People undergoing these treatments should talk with their doctor or oncologist before taking vitamin E or other antioxidant supplements, especially in high doses. Eye disorders. Age-related macular degeneration (AMD), or the loss of central vision in older people, and cataracts are among the most common causes of vision loss in older people. The results of research on whether vitamin E can help prevent these conditions are inconsistent. Among people with AMD who were at high risk of developing advanced AMD, a supplement containing large doses of vitamin E combined with other antioxidants, zinc, and copper showed promise for slowing down the rate of vision loss. Mental function. Several studies have investigated whether vitamin E supplements might help older adults remain mentally alert and active as well as prevent or slow the decline of mental function and Alzheimer's disease. So far, the research provides little evidence that taking vitamin E supplements can help healthy people or people with mild mental functioning problems to maintain brain health.